Okay, good morning, everyone. Thank you for joining us today. This is the Rock County Public Health Media Briefing for December 9th, 2021. And this briefing is being streamed live on the Rock County Public Health Department's Facebook page. The recording will be available after the briefing on our Facebook page and on our YouTube channel. My name is Jessica Turner. I'm the Communications Specialist for the Rock County Public Health Department. For today's briefing, we have Katrina Harwood, Health Officer for the Rock County Public Health Department, Kara Sankey, System Chief Nursing Officer and Vice President of Mercy Health, Eric Thornton, Hospital President of SSM Health St. Mary's Hospital, Janesville, and hopefully we will shortly have another guest joining us. We are expecting Dr. Samaraju, infectious disease physician for Beloit Health System. So first, we will be hearing some COVID-19 updates from the Public Health Department, and then some remarks from our health system representatives, and then we will open it up to questions from our participating media. So I will start by turning it over to Katrina to give us some COVID-19 updates on our data and some additional updates on the current status of the virus. Go ahead, Katrina.
Thank you, Jessica. 22,728 Rock County residents have tested positive for COVID-19 over the course of the pandemic. Over the past week, we have been averaging around 107 new cases per day, which represents an ongoing increase in case activity over the past several weeks. Currently, there are approximately 1,960 known active cases of COVID-19 in Rock County, and 234 Rock County residents have died due to COVID-19. Most recently, we have had 57 people who are positive for COVID-19 receiving care in the hospitals. For vaccinations, 58% of the Rock County population has received at least one dose of COVID-19 vaccines, and 56% have completed the vaccine series. More than 2,500 children between the ages of 5 and 11 have received at least one dose of the vaccine, and just under 1,000 children between the ages of 5 to 11 have completed the vaccine series. Additionally, nearly 27,000 booster doses of the COVID-19 vaccines have been administered to Rock County residents. Vaccination continues to be critical, especially with the unknowns of the new Omicron variant that was identified in Wisconsin on December 4th. We do not yet have confirmation of the Omicron variant circulating in Rock County, but a main concern with the Omicron variant is that it may spread more quickly and be more contagious. Regarding severity, we do not yet know if the Omicron variant causes more severe illness than other forms of the virus, including the Delta variant, which continues to be the main variant in the United States and in Wisconsin. Current vaccines are expected to protect against severe illness, hospitalization, and death following infection with the Omicron variant. However, breakthrough infections for people who are fully vaccinated will likely continue. As a health department, we continue to contact individuals who test positive for COVID-19 to ensure they have the information necessary to reduce the likelihood that they spread the virus to other people. As mentioned, we are at a critical time in terms of rising infections and hospital capacity. Our healthcare workers are struggling to keep up, and we as community members need to do our part to help them. Currently, local hospitals have reported emergency department activity that is nearly double what it was this time last year. In addition to the 57 individuals who are receiving inpatient care due to COVID-19, many hospital beds are also being occupied by those who no longer have active cases of COVID-19, but remain hospitalized and seriously ill following their infection. Most hospitals in the Midwest are full, and it's becoming increasingly difficult for hospitals to transfer patients if needed. Our health systems, which are now very near or at capacity on a daily basis, need the community's help. To assist, when feeling ill, people are asked to visit a clinic office instead of the emergency department whenever possible. Telehealth options are also encouraged. If you are in need of immediate medical attention for a severe or life-threatening situation, please continue to seek care at your emergency department. Vaccination is still our most effective tool to control the spread of COVID-19, prevent severe illness, and maintain our hospital capacity. Community members who have not yet received the COVID-19 vaccine are encouraged to get vaccinated as soon as possible. Individuals age 18 and older who are fully vaccinated are encouraged to get a booster shot at least 6 months after completing the Pfizer or Moderna vaccine series, or 2 months after receiving a Johnson & Johnson vaccine. The COVID-19 vaccine is free, and there are many vaccine locations and opportunities available. Visit rockcountyshot.com or vaccinefinder.org to find a provider near you. If you need a ride to a COVID-19 vaccine clinic or appointment, call 211 for assistance. It also remains critical to get tested if you have symptoms of COVID-19 or have been in close contact to someone who has tested positive. To learn more about testing options in our region, visit rebrand.ly/RCPHD-COVID-testing. In addition to getting vaccinated and getting tested for COVID-19, we also recommend getting the influenza vaccine as soon as possible, wearing a mask in all public indoor settings, regardless of whether or not you're vaccinated. We also recommend that people choose smaller gatherings, wash hands regularly, maintain physical distance, and minimize indoor time with others from outside their home. At this time, I'll pass it back to Jessica.
Thank you, Katrina. We will now give the health system representatives a chance to provide any additional remarks that they have before we open it up to questions from the media. So I will start with Kara Sankey from Mercy Health. Go ahead with any remarks that you have.
I would just like to mention that the current situation in our hospitals is putting a strain on many of our resources. Our hospitals are experiencing a high volume of COVID and non-COVID patients requiring care and hospitalization. Due to the high volumes, our intensive care units and intermediate care units and overall bed availability within the area is at a critical level. And again, to echo, when feeling ill, patients should visit a clinic office instead of the ED. Also encouraging people to use telehealth options. Patients who do need to visit the ED should be prepared to face extended wait times due to the current crisis and state of critical capacity. That's what I have. Thank you.
Thank you, Kara. Next, I will go to Eric Thornton from SSM Health St. Mary's Hospital, Janesville. Eric, you can go ahead with any additional remarks that you have.
Good morning. Katrina and Kara did a wonderful job of explaining the current situation. I think the only thing that I would like to emphasize is, again, in terms of emergency room visits, of course, if you need to visit an emergency room, please do so. So we don't want to do anything to discourage folks from coming into the emergency room that need that type of care. However, if your symptoms are more mild or you have something going on that could be handled either in an urgent care environment or in a clinical setting, we do encourage you to use those resources instead so that we could keep our emergency departments available for those folks that truly need an emergency. Other than that, Katrina and Kara covered all my talking points.
Thank you, Eric. I think I saw Dr. Summers, you tried to join, but she hasn't quite joined us on the meeting yet. So we will circle back to her at the end if she has any remarks, if she's able to jump onto the meeting. So at this point, I'm going to turn it over to the media for questions. We have a couple participants today, so I'm just going to ask that you raise your hand if you have a question, and we will allow you to unmute and ask your question. If you are joining us via phone, just a reminder that *9 will raise your hand and *6 will mute and unmute your phone once you are called on. So it looks like our first question is coming from Austin Montgomery from Beloit Daily News. Go ahead, Austin.
Hi, thanks for doing this today. Just wanted to clarify, there was a number that was referenced that said nearly double of what I'm not really sure what that activity was, whether it was emergency department care. Just wanted to clarify that data just right off the top. It was something that was referenced as nearly double as what it was this time last year. So just wanted to clarify. Thanks.
Thank you, Austin. To provide that clarification, our local hospitals have reported emergency department activity that is nearly double what it was at this time last year.
Thanks for the question, Austin. Thank you, Katrina, for the response. It looks like we have Dr. Samaraju on, but she is in the attendees section. So I'm just going to give her the ability to unmute real quick here. And Dr. Samaraju, you can go ahead and unmute and provide any additional remarks that you have at this point. Are you there, Dr. Samaraju? If you're on your phone, *6 will mute and unmute your phone.
Okay, can you hear me?
Yes, we can. Hi, doctor.
So you have any questions on me? You want to give you update on what is happening in our hospital? What are you?
Yeah, if you sure. If you have any, we did give some overview, and we had Mercy Health and SSM provide some updates from their end. If you have any additional updates, you can go ahead and give them now. Otherwise, we'll continue with questions.
So, as everybody mentioned, even our hospital is, to our capacity with all these COVID patients and also non-COVID patients. So, definitely we are seeing a spike in last couple of weeks. So again, the summary of Omicron or COVID update given earlier, I think it gives all the information. There is so much uncertainty about Omicron at this point, where the transmissibility as well as intensity and severity of Omicron is all uncertain at this point. So again, the vaccine coverage, Moderna or Johnson & Johnson or Pfizer, any of these vaccines, what is the level of protection? We don't know at this point, but definitely there is mixed messages in the media. So I just don't want to say what is going to work best at this point. I think we have to hear from the authorities to get a little more info on the vaccination coverage at this point. So I can give you a little more info on the Omicron, the things coming out because of its multiple mutations. They believe it has mutations up to 32 to 52. It's anywhere from 32 to 52, compared to Delta is about 9 to 12 mutations. So definitely the Omicron variant has a lot of mutations. So at this point, it may be good, it may be bad. We don't know, again, the intensity of these mutations and the severity of the infection. If there are any questions, I'm glad to take those questions. Hello?
Thank you, Dr. Samaraju. So we will go back to our media partners, and if there are any additional questions, please raise your hand, and
Sure.
we will give you the ability to mute and unmute your phone. So
Sure.
it looks like we have another question coming in from Austin Montgomery, Beloit Daily News. Go ahead, Austin.
Thank you. Just wanted to clarify, is there data related to the percentage of what ICU beds and hospital beds in general are available in Rock County? Just wanted to see if there were some figures we could get on that, just to put out there to really kind of describe the direness of the situation. Thank you.
So I can jump in real quick and give kind of a brief overview of where we're at as a county, and then if any of the if anyone from the health systems wants to jump in and give more details, feel free to do so. But as a whole, right now, the hospitals are full. We've gotten reports from some of our hospitals that they are at capacity. Over the past week or so, there has been approximately 1% bed availability for ICU and med-surg beds being reported. And all of our hospitals have indicated that they are at peak census. So maybe one of our hospital representatives can elaborate a little bit more on what that means as far as being at capacity or being at peak census. But we also have 50% of our hospitals reporting critical staffing shortages in the form of nursing staff and environmental staff as well. So if anyone else has more information or more viewpoints from your point of view, go right ahead.
Yeah, what I would like to add, this is Eric from SSM Health St. Mary's here in Janesville. What you said, Jessica, is true. We are at peak census, and certainly that does put a stress on our system. However, I do want to emphasize, and I'm certain that this is true for the other healthcare providers in Rock County as well, we continue to provide exceptional care. So we do want to encourage folks that need to come in for care that they should be very comfortable doing so. But yet, you know, the way that the community can help us is by doing those things that Katrina talked about for folks that have not yet received the vaccine to become vaccinated, both for influenza as well as COVID, for folks to focus on smaller gatherings instead of larger gatherings, wear a mask 6 feet apart, staying home if you're not feeling well, all of the things that we've been talking about for the past 18 months. You know, we've heard from the community that they want to help us, and the best way that they can help us is by doing those things.
Thanks, Eric. Kara and Dr. Samaraju, do either of you have anything to add?
So as everyone is saying that every hospital is full, and including our hospital, the Light Health System. So what I can just advise for the community is what if somebody just said, if you did not take a vaccination, go ahead and take vaccine. If you did not get boosted, please go and take the booster shot, and also the influenza shot. And I guess, again, we are also seeing some uptrending in the influenza also this year. So every hospital is trying to, is getting 2, 3, 4. So I think the numbers are going up. I don't know how many we have in our hospital at this point, but definitely we are seeing the flu season is also hitting the community. So we are in a mix of COVID and the Omicron variant plus the flu. So we are in a place that we need to protect ourselves. Every citizen should take the responsibility of protecting themselves.
I would just, again, highlight what they said, but for some perspective, it's not all COVID, but the volumes of all of the other conditions and diseases that have been progressing are still using some of those critical care beds. So I can speak for my organization to say that there's typically no empty critical care beds at this point, and we typically have a wait list of people coming into those beds as people do transition out.
Thanks, everyone. Let's see, it looks like we have another question, and this one is coming from Bill Lathrop of Evansville Today. Go ahead, Bill.
Hi, thank you very much for this. I've heard, this is more to public health. I've heard concerns from some of the teachers in our school district that they don't feel that all cases are being reported on our school dashboard. I think it's possible that there's confusion between live cases and those who are in quarantine. At any rate, the question is, how are cases that are discovered within the school systems reported to the county?
Do you want to take that one, Katrina? Otherwise, I can jump in here.
Sure, I'll go ahead and start. So any lab, any testing provider who is conducting testing, and we do have several testing providers who are working with our local schools, are required to report the results of the test into the statewide disease surveillance system, and then we get the results from that. We do know that there are occasions when some of those test results are not being reported either as timely as we would like, or following a test. We find that sometimes the test results from the rapid tests aren't being as reported as expected. However, We do still expect that all test results be reported in our disease surveillance system, and we do follow up for those cases as we identify them. And Jessica, if you have anything additional, please add it.
I just wanted to add one thing. So I just wanted to add that if you are getting one of the at-home tests that aren't necessarily going through one of the labs, we do encourage you to call the local public health department if you test positive, so that we can give you some further instructions and let you know what the recommendations are for those who test positive. And then that will also contribute to more accurate data on our end. Okay, and it looks like we have another question from Bill. So go ahead, Bill.
Thanks. Are we seeing any trends in the health systems regarding critical care relative to vaccination status?
So again, I can jump in, and if anyone has anything additional, you can go ahead and add it. But just from the health department standpoint, what we're seeing from our data is that roughly 80% of the recently hospitalized patients have been unvaccinated. So, and then in the approximately 20% that are fully vaccinated, the average age is 75. So what this is showing us is that those who are older and fully vaccinated are at higher risk of needing to be hospitalized if they contract COVID-19, which is not all that surprising since they have been in the higher risk category throughout the pandemic. We are still seeing data that shows people who are fully vaccinated have greater protection from severe illness. That continues to be the case. And I just want to stress that it is important that people receive that booster dose as soon as they are eligible.
Anyone else? Yep,
go ahead.
This is Dr. Somaraju. I can add something to that. Definitely these vaccines are helping. And as you said, the ages can range from 25 years to 75. And the 75 years are patients who took, some of them even took boosters, but they have so many other comorbidities. But some of these patients, older patients who got boosted and everything, who got the infection, actually it was a mild infection, then even got discharged from the hospital. So definitely the vaccines and the booster shots are helping. So my recommendation is go and take the vaccinations. And majority of our hospitalized COVID patients are unvaccinated, and we do have some 10 to 15% are vaccinated. Some are waiting for boosters, so they are more than 6 months after this first 2 series. So they are in sort of gray zone where their immune system is waning, plus they have additional comorbidities. So, and those patients who received the vaccine plus the booster are very few of them, but they have so many comorbidities. So what I'm trying to impress here is go and take the vaccination. That is my word for the day.
I would just add, this is Eric again here at SSM Health. It's very much the same. Most of our hospitalized COVID positive patients are individuals that are unvaccinated. And that's most, but not all. But I couldn't agree more with the comments that were just made regarding vaccination. That's for folks that have not done that, that is what they should do.
Thank you. Looks like we have another question now from Austin Montgomery, Beloit Daily News. Go ahead, Austin.
Thanks. Just wanted to clarify on that figure that was mentioned about critical staffing shortages at Rock County hospitals. I just wanted to see what that figure was and if there's any insight on to what positions are most needed. Thank you.
So the figure was 50% of our hospitals, so 2 out of the 4 are reporting critical staffing shortages in their nursing staff and environmental staff. That's the information that we have. I don't know if anyone has anything a little bit more specific or would like to add anything to that.
Now, what I would add, this is Eric, there is, it's been well reported that there's a nationwide shortage in staffing right now, particularly in those roles that you just mentioned, Jessica, and local hospitals are not immune from that. That said, though, we do have the appropriate number of staff to take care of our patients. We continue to provide exceptional care. I don't want individuals to get the perception that they shouldn't go in for care if they need care.
I echo what Eric just mentioned. I would say that, the time there, again, there's been an ongoing nursing shortage for many years, and this has exacerbated it. And I think also shown that it's hard to train new staff into a pandemic, and this is not easy work for any of them. And it's hard to get them up and moving and working and being competent to do that, but we are doing it. We're doing it safely, and it is safe to come in, but it is challenging and it is straining on the staff. There's a lot of extra things that need to happen in order to care for patients with COVID, and including isolation status, staffing them safely, and making sure that we have all the resources to make sure that those that are non-COVID are also safe in the hospital. So there's always a need for more help, but we're able to provide that help. But the shortage is going to go with the nursing shortage, which is a bigger concern as well going into the future.
One other thing to add to that on a similar note, Kara made me think of something else. So what that means then is for the staff members that are working, they're working very hard. So as you seek care within healthcare environments, be kind and patient with the staff. Everybody is doing the very best they can. And if you know a healthcare worker, thank them. Particularly these days, they're working very hard, and they've been working very hard for a long period of time. So make sure that you take an opportunity and let those individuals know how much you appreciate them.
Thank you, Eric. I completely agree.
Thank you. Let me check, do we have any additional questions from our media? Okay, looks like we don't have any additional questions. So we will conclude today's briefing. These media briefings take place every other Thursday at 11 a.m. They are live streamed on our Facebook page, and the recordings are made available afterwards on our Facebook page and our YouTube channel. I want to thank everyone for participating. Thank you to Kara, Eric, and Dr. Samaraju, and thank you to our media participants today. And thank you to everybody who's been watching the live stream. So if you are a member of the media and you would like to participate in a future media briefing, please send me an email at media.publichealth@co.rock.wi.us, and I will provide you with the information that you need to participate. Be safe and be healthy, everyone.